Chapter 12, Seminal Fluid Analysis. So seminal fluid or semen is really a complex body fluid that's used to transport sperm. And really it's used to analyze the infertility or follow-up measures after a vasectomy to ensure that the surgery was effective. Now there has been other applications too, such as forensic evaluation, and that will be discussed in the next few slides. Let's look at a schematic drawing of the male reproductive tract. So semen is composed of secretions primarily from the testes, epididymis, prostate, and seminal vesicles, with a small amount derived from the bulbourethral gland. The testes are really a paired set of glands that are suspended in the scrotum outside of the body. The reason for this is because it allows for the lower organ temperature that's necessary for the production of sperm. The testes perform an exocrine function by secreting sperm and an endocrine function by the secretion of testosterone. Now these functions are independent or interdependent on the pituitary hormone, follicle stimulating hormone, and luteinizing hormone. Now sperm production is regulated by Sertoli cells in the seminiferous tubules, where production and secretion of the male sex hormone testosterone is the responsibility of the interstitial cells of Leydig, which are located in the interstitium of the testes between the seminiferous tubules. Let's talk about the pathway of sperm. So when these Sertoli cells release sperm into the lumen of the seminiferous tubules, they are non-motile and immature at this point. The luminal fluid from the Sertoli cells carries the sperm into the tubular network of the epididymis. This is where they undergo final maturation and become motile. The epididymis will also add the extra fluid to the lumen. Then the epididymis ultimately forms a single duct that joins the vas deferens. The vas deferens is a thick wall muscular tube that transports sperm from the epididymis to the ejaculatory duct. Secretions from the vesicles are added to the ejaculatory duct, and both ejaculatory ducts pass through the prostate gland and empty into the prostatic urethra along with secretions from the prostate. The entire process of spermatogenesis and maturation takes approximately 90 days. Now let's discuss specimen collection. Because the concentration of sperm in normal seminal fluid can vary significantly, 2 or more samples should be analyzed to evaluate fertility for men. Specimen collection should take place within a 3-month period and at least 7 days apart. Sexual abstinence for at least 2 days, but not exceeding 7, should precede the collection. So the patient will collect the specimen through masturbation, and the entire ejaculate is collected in a clean, wide-mouth plastic container. The container can be kept at room temperature or warmed to avoid the possibility of cold shock to the sperm. The time of actual specimen collection is very crucial in evaluating the liquefaction and sperm motility, so it should be transported to the lab within 1 hour. Body fluid, there must be a physical examination. Normal semen is a gray-white or opalescent color. A red or brown hue may indicate the presence of blood, where yellow can be associated with certain medications. If there are large numbers of white cells present, the semen can appear more turbid than translucent. When the specimen appears clear, the sperm concentration is usually low. So semen is a homogeneous viscous fluid that immediately coagulates after ejaculation to form a coagulum. And within 30 minutes, this coagulum liquefies or becomes watery. The actual time of collection must be known to evaluate this liquefaction. Although it can take longer, any delay beyond 1 hour is considered abnormal and has to be noted. As for the volume, the physical microscopic analyses should take place immediately after liquefaction or within 1 hour. The volume is measured to 1 decimal place using a pipette and is normally between 2 and 5 milliliters. Volume less than or greater than are considered abnormal and have been associated with infertility. Now for viscosity, after complete liquefaction, the viscosity of the semen is evaluated using a pipette and observing the droplets that are formed when the fluid is allowed to fall by gravity. A normal specimen is watery and forms distinct droplets. Abnormal viscosity is indicated by the formation of a string or a thread that is greater than 2 centimeters in length. A high content of mucus can definitely increase this viscosity. About the microscopic examination of seminal fluid. So standardization is very important, and only certain personnel have worked with seminal fluids. There are guidelines by the World Health Organization in determination and examination of processing seminal fluid. But here the very most important element of the microscopic examination is motility. Because if they are not motile, they're not able to fertilize an ovum. So after complete liquefaction, the semen sample is mixed to ensure there is homogeneity, and a volume of each specimen is evaluated and placed onto a microscope slide. The sample is covered with a cover slip, and the slide is allowed to settle for a minute, and then the motility is graded based on the amount of forward progression. So here in table 12.2, the speed and forward progression of each sperm are evaluated. So normally within 60 minutes, 50% or more of the sperm will show a moderate to strong linear or forward progression. And here you can see how the lab scientists evaluate based on a grading scale from 0 to 4, where 0 being immotile, 1 plus would be motile with forward progression, 2 motile with slow linear or meandering, like not going forward and straight, but sideways progression, 3 plus being motile with a moderate linear or forward progression, and ultimately we want to see a 4 plus with motile and strong linear forward progression. Talk about the concentration of sperm count. The concentration of sperm in an ejaculate is considered normal when it's between 20 to 250 million per milliliter of sperm present. Values less than or greater than this range are considered abnormal and are associated with infertility. So if you are doing a manual count, the concentration is determined by using a hemocytometer with using a 1 in 20 dilution. So the total number of sperm present is often calculated by multiplying the sperm concentration by the total volume of the ejaculate. Now, post-vasectomy counts are usually done about 3 months after the procedure. Remember, a total spermatid or spermatogenesis takes about 90 days. So any sperm remaining in these tubules have to be cleared within about 90 days, and that way they can detect if the procedure was effective. Now let's discuss sperm morphology. Human sperm have three distinct areas: the head, midpiece, and tail. When viewed from the top, a normal human sperm should have an oval head that are about 2.5 to 3.5 microns in width and 4 to 5 microns in length. The midpiece is located immediately behind the head and is about 6 to 7.5 micrometers long and is thicker than the tail but not greater than 1 micron in width. The tail should be slender, uncoiled, and at least 45 micrometers long. When a basic morphology is performed, each sperm is identified simply as normal or abnormal, with the percent of normal forms being reported. Now, in image C, you see a spermatoid under a phase contrast microscope where the head is kind of illuminated, where the nucleus lies. Let's talk about sperm morphology. These are the different images that sperm can look like. The reference range for normal varies with different labs, but they determine that normal sperm morphology is about 50% that's considered normal. When strict criteria are there for fertility, normal sperm morphology of less than 5% is a strong indicator of infertility, where fertility is associated with normal sperm morphology of values greater than 15%. So in image 1, or A, we see a normal spermatozoa. You have an acrosome in number 1, a post-acrosomal cap. You definitely see the midpiece and tail. Now let's look at image B, where you have an abnormally large head. And in C, you have a tapered head. D, you have tapered heads with some kind of acrosomal deficiency. In E, you have a complete acrosomal deficiency. In F, you have a head vacuole. G, you have some kind of midpiece defect or a cytoplasmic droplet. H, you have a bent headpiece. This might help or hinder the forward progression. I and J are coiled tails, and K, you can have also a double tail in pairing phenomena. Now, M is not a white cell. These are immature or precursor spermatids. And you could have one with double heads. Now, again, as long as they can perform their function, this is not a concern for infertility. Discuss vitality. We are using a stain from a fresh sample that will enable the differentiation between live and dead sperm. Because dead sperm have some kind of damaged plasma membranes, these cells take up the stain and living sperm do not. So when there's a large percentage of immotile sperm observed, it can help us determine whether the sperm are immotile because they're dead or because there's some kind of structural abnormality, like you've seen in the image or slide before, such as a defective tail. Now, other sperm or other cells can be seen, such as white blood cells, which can hinder the fertility process, especially if there's inflammation going on. So any red cells that are there are abnormal and definitely would consult a physician for what's going on. It's very unlikely to see spermatoid or immature cells come out, but they can resemble white blood cells. Remember, all of the maturation should happen in the testes and epididymis. If you're starting to see immature cells coming out, this is also a concern to physicians. Now, agglutination is also a problem because even a small amount is abnormal if the sperm is alive because they cannot move forward due to the agglutination of the actual specimen. Now here is a vitality stain where the sperm are alive, meaning the membranes are intact, And the pink stained sperm are dead, and this is meaning that the membrane is damaged or permeable. So now let's talk about the chemical examination of seminal fluid. So the pH of a normal semen is alkaline and ranges from 7.2 to 7.8. Fresh specimens with a pH of less than 7.2 can be obtained from people that have any kind of abnormality in the epididymis, the vas deferens, or the seminal vesicles. Now, in contrast, if you have a fresh specimen that exceeds a pH of 7.8, this is very suggestive of an infection of the male reproductive tract. Fructose is a good measurement of evaluation of the seminal vesicles because it's produced and secreted by these vesicles. Its presence in semen reflects the function of this gland and the functional integrity of the ejaculatory ducts and vas deferens. So normally, the serum fructose level are equal to or greater than 13 micromoles per ejaculate. Biochemical markers can also be used. The usefulness of zinc and citric acid are markers that talk about the function of the prostate. So any correlations with low zinc levels could indicate an infection of the prostate. In addition, citric acid is a major anion in semen and as well can help determine if there's any kind of prostate problem. Acid phosphatase can be used to assess the secretory function of the prostate as well, and can also be present in vaginal fluid specimens, and can also be used to obtain an alleged rape or sexual assault case. Now, table 12.1 is a very good table to put it all together. So you know the physical, the microscopic and chemical examinations, under which category they fall, the reference interval, and the lower reference interval to help you study.